Hi, everybody. My name is Lisa Ray Thomas. I'm a member of the Tlingit tribes, and I'm a consultant with the American Indian Health Commission of Washington State, or the Commission. And I'm also with the University of Washington Addictions, Drug and Alcohol Institute, or AIAN. And I'm happy to be here virtually to give you an update on the work being done by the American Indian Alaska Native Opioid Response Workgroup for your May 4th delegates meeting. And I apologize, I'm going to have to turn off my video while I advance the slides so I can see my screen. So the AIAN work group is hosted by the Commission, as you know. And today I'd like to give you a really brief presentation, updates of what we've done to date and ideas for future work. So first of all, the work group identified an Indigenous methodology to guide the work being done. And the work group selected the Pulling Together for Wellness framework, which is a framework that the Commission uses for all of its work. It was developed in collaboration and by and with American and Alaska Native people in Washington State. And this methodology has the following principles: sovereignty, being grounded in culture and community, focusing on and including the full lifespan from cradleboard to elders, focus on 7 generations and beyond, being strengths-based and collaborative, being iterative, being based in Indigenous science, and trauma-informed. So the work group was implemented in 2019 and met monthly. After we identified the Indigenous methodology, the first task was to develop and implement a needs and strengths assessment to look at where are the strengths, where are the gaps for people with opioid use disorder, for American Indian and Alaska Native people with opioid use disorder in Washington State. From that assessment, we crafted a report, which we shared with you in 2019. We identified priorities. We networked and accessed various resources to strengthen opioid response work. And then, as everybody knows, in early 2020, COVID interrupted the work, and we took a long pause so that work group members could really focus on keeping their communities healthy and safe. One thing we did do was do a very brief survey looking at the impact of COVID on opioid use disorder, or OUD, services. So going forward, we've resumed meeting as of March 2022 and have developed a list of potential priorities and discussion items. These include, but are not limited to, doing a 3rd survey to update our first 2 surveys, identifying education on fentanyl and overdose response training for AIAN communities and urban programs, to connect tribes and urban Indian health providers with Dr. Mike McDonald at Washington State University on contingency management as appropriate and requested. Contingency management is an evidence-based practice for serving people with stimulant use disorder. We are talking about collaborating with Desitol Hegi on messaging around stigma. Stigma was identified as one of the greatest barriers for people with opioid use disorder to seek and receive services. To find resources to help with messaging on intergenerational trauma and intergenerational clarity. To hear from Chris Shera. Chris is the Washington State Opioid Response Coordinator at the Healthcare Authority. So to hear from Chris about forthcoming opioid settlement funds that are potentially available to tribes and urban Indians. And these would be in addition to the funds, any settlement funds that tribes and urban programs are receiving. To hear from Larissa at the Northwest Portland Area Indian Health Board to provide an update on TOR, or tribal opioid response work in Washington and how to coordinate the work that this work group is doing. To hear preliminary and final reports on the Native Transformation 2 project that's being done with the Northern Tribes in Washington. To hear from Eliza Powell at Northwest HIDA, or High Intensity Drug Trafficking Area, about relevant data and information for American Indian Alaska Native people and communities in Washington. To have a presentation from the University of Washington ADAI CEDAR, Community Engaged Drug Education, Epidemiology and Research, about the 2021 Syringe Services Program Survey. 10% of the respondents to the 2021 survey were American Indian Alaska Native, so this is really relevant data. To hear from Wendy Stevens and discuss her ideas about culturally grounded and appropriate responses for communities who are experiencing grief and loss from overdoses. To hear from the Department of Health and the Healthcare Authority about their drug response team and how to partner with tribes and urban programs to make sure that those response teams and responses are culturally appropriate. This is a team that comes to support communities who are experiencing high levels of overdoses in their community or other negative impacts from substance use disorders, primarily opioid use disorder, and then any other ideas that the work group comes up with. So as I mentioned, we resume meeting in March of 2022. We meet the second Tuesday of each month from 3 to 4:30. The next meeting is May 10th, and then the second Tuesday every month thereafter, and everyone is welcome. So thank you so much for your time today and for all the work that you do and for your patience with my less than stellar skills with Zoom. Thank you.